Insomnia can often rear its ugly head during times of stress and crazy life events. Can you say pandemic? As a result, we often reach for a quick method to help overcome it in the form of a sleep aid. But is using a sleep aid really the best solution? We'll be taking a look at this on today's episode. I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back. I am so glad that you joined me. I want to take a moment to say to our Muslim listeners to have a blessed Ramadan, to our Jewish listeners to have a happy Passover, and to our Christian listeners to have a happy Easter. This is the first time that I remember all three of these happening at the same time. So I hope everyone is having a good holiday. I also want to take a minute to touch base about last week's episode. Now, as I pointed out in my anniversary episode, I've been doing a lot of extra study and research into some things that we don't traditionally do through clinical academic sleep medicine. And insomnia is one of those things. And one of the things that I've been doing is just sort of following a lot of the insomnia boards and YouTube channels. And I saw a lot of comments about the article that I presented last week with regard to it causing a lot of people with insomnia to really second guess themselves. Now, if you've never suffered from chronic insomnia, bless your heart, I hope that you never do, because it can be really difficult. So one of the things that people who have suffered from chronic insomnia have to do, they have worked really, really hard and put so much effort into getting a good night's sleep that when you sometimes see information like this, it causes you to rethink your whole scheme. For example, if you're someone who does have a little bit of light on, just because you find that helps you sleep a little bit better. If you have gone through all of the iterations of lights on, lights off, lights high, lights low, then you have done a lot of work to try to make sure your sleep environment is as comfortable for you and attuned to your needs as possible. And seeing something like this can cause you to think, well, shoot, what if by having this little bit of light on, I'm affecting the way that my heart rate, is during the night. I could be affecting my cardiovascular health. So I want to always point out that part of why I do this and why I started this podcast is just simply to present information so that people can start talking about sleep. I think that it is something that is very underserved in our population, that we don't have enough information to make informed decisions about what we do, medicines we take, choices that we make about our sleep. And that's part of my goal with the podcast, is to present that information. Sometimes the information can sound a little sensational. If you are someone who is affected by stuff like that, I apologize, and I hope that I can be more sensitive moving forward in the way I present this information. But do always remember that my goal is just to give you information. It's not to affect your ability to get a good night's sleep, other than by giving you choices. So please take all information from any study that you see or that you report that you see in the news. Take that with a grain of salt, because there are hundreds of studies published each month about sleep and sleep education. So some of them report one thing, some may report just the opposite. That's part of academic research, is that you propose a hypothesis, you develop a study protocol behind it, and you look to see what the results are. So please remember to take some of that stuff with a grain of salt. Now, on to today's episode. Speaking of insomnia, I think that it's important to point out that even though we have all suffered from insomnia at a time, it's very easy to say, I'm just going to talk to my doctor and maybe get something to help me sleep. And in the short term, that can be a very effective method to overcome transient insomnia. You have a busy deadline at work and you're just not sleeping. You've gone through a divorce. You are facing an illness that is causing you some discomfort, that you just need something to help you get a few good nights sleep under your belt so that you can just think about things and proceed with your life a little more effectively. Now, one of the things I like to point out is that the use of long-term sleep medication isn't necessarily something that you will see through a lot of sleep disorder centers, because we recognize that the treatment of insomnia is a lot more involved than that. So usually we'll see prescriptions for sleep aids coming from primary care doctors and internists, just to help their patients get a good night's sleep. And people will stay on these things for a long time. And I am one of those people. I was on a sleeping medication prescribed by my primary care doctor for a very long time. I think part of that for me was because it was easier. It was easy to just take a pill and get a good night's sleep. Unfortunately, I found that just taking the pill wasn't really helping me get the sleep that I needed. So ultimately, I made the choice to discontinue that and to try something a little bit different that I'll talk about here in just a bit. But for me, having been on a long-term sleeping medication came with some side effects. One of those side effects, and this is the same for many people, was a bit of a psychological dependency. On those nights that I would stop or not have the sleeping medication for whatever reason, I simply wouldn't sleep well. And a lot of that involved me telling myself that I don't have my sleeping pill and I'm not going to sleep well. So those of you that have been treated for insomnia probably recognize that symptom. But both physical and psychological dependence can be the result of taking long-term sleeping medication. In addition, there can be a lot of other consequences. For example, people who take a long-term sleeping pill are 90% more likely to be involved in a car accident in the morning after a night that they have taken that sleeping pill. Even though you may not necessarily feel as groggy or as impaired as the studies may show, you can almost be as impaired as if you were drunk. Also, patients taking sleeping medications are 34% more likely to suffer from a fall because their dexterity can be affected by that. Studies have even shown that taking some of these for a long term can affect our risk of developing dementia. So that's one of those types of things that I point out, take with a grain of salt, because there are lots of studies that look at these things, and nothing is conclusive yet. So just because it increases our chance doesn't mean that is exactly going to happen. It just means that there's more of a likelihood that will happen. So that's the type of information that I want people to have to be able to make an informed decision on the treatment that they get, specifically with their healthcare provider. So I always like to make sure that it spurs a conversation. Interestingly, the American Academy of Sleep Medicine has in their clinical standards for practice, they don't recommend the use of over-the-counter medications for sleep. Most of those are an antihistamine or a medication called diphenhydramine. And the reason they don't recommend it is because there's not been sufficient evidence to show that they're any better than a normal night's sleep. Also, the more you take a medication like that, the less effective it will be for you over time. So something to take into consideration. Now, one thing that we do know is that treatment for insomnia, especially long-term insomnia, isn't best treated with a pharmacological method. It's best treated through a cognitive behavioral method. There is a cognitive behavioral therapy for insomnia that many studies have shown that is just as, if not more effective at treating insomnia than sleeping medications. So there are alternatives. Please talk to your healthcare professional if you run into a situation where you are suffering from insomnia and you just need some relief. As I mentioned earlier, cognitive behavioral therapy is what I've been using to help myself overcome my insomnia, and I'm surprised at how effective it has been for me. And this is from somebody who has spent his adult life working in sleep medicine. It's just something that from a clinical standpoint, we haven't really explored a whole lot in the clinical setting. Like I say, we tend to send these patients to either a psychiatrist or a psychologist who's trained in this method to help their treatment, and they usually take over the treatment from there. So I've been really pleased and excited to learn some of this information about the effectiveness of CBTI, and can present that it is effective myself. So always options, always something to consider. Please remember to take all of this stuff into consideration when you talk to your doctor when you're having some episodes of insomnia. And I hope that moving forward, you will be able to get the sleep that you need. Please remember to reach out to me, jay@somnilopod.com. If you have questions, comments, please remember to leave reviews on the podcast site or whatever method you are consuming the podcast on. And always, always, always remember to make sleep a priority. Thanks so much.